Hi, I'm Mark Nantz, and I am the new President and CEO of Valley Health System. I know what you're thinking. Seriously, another guy named Mark? What are the chances of that? I've actually had several phone calls this week from people thanking me for my dedicated service to Valley Health System and wishing me a happy retirement until I stopped them and told them that I was actually the new guy. I have to admit it was a little unnerving on my first day having people wish me well in retirement. In any event, I am taking over for Mark Merrill, who retired last week after 11 years at the helm. I would be remiss not to take this opportunity to acknowledge all of his accomplishments and contributions to Valley Health System and thank him for his dedicated service. Congratulations, Mark, on a job well done. It never crossed my mind that the week after I accepted this role that the world as we knew it would go into lockdown as a result of COVID-19. I've had the opportunity to observe how well Valley Health System and its dedicated providers and associates have responded to this crisis. The tremendous work that each of you are doing to minister to our patients and protect our community during this pandemic is extraordinary. I know that many of you have made personal sacrifices and put yourselves in harm's way to fight this battle. Thank you. Our communities and our families are safer because of your expertise and dedication. It is a great honor to be selected to lead the exceptional Valley Health team, and I look forward to working with and getting to know each of you in the coming weeks and months. My wife Courtney and I have finished unpacking and are starting to feel settled into our new home in Winchester. Now that most of the work of moving is behind me, I'm excited to roll up my sleeves and get started as your new CEO. These are certainly strange times, and under normal circumstances as your new leader, I would be able to meet with each of you face-to-face in groups. Unfortunately, meeting in groups isn't safe, and your safety is very important to me. So for now, I'll have to introduce myself virtually and meet you one-on-one while I'm out in our facilities and hopefully in groups in the near future when it is safer to do so. Winston Churchill once said, "Healthy citizens are the greatest asset any country can have." I believe that with all my heart, and it's why I've spent nearly 30 years in not-for-profit healthcare. It is at the core of my call to serve in the ministry of care delivery. To be sure, I feel that each of us has been called to serve others by providing access to high-quality, affordable care and an exceptional patient experience, regardless of whether or not those individuals have the ability to pay. I think that we are called to treat everyone who walks through our doors with dignity and compassion, and that we must respect and appreciate the unique set of beliefs and experiences that they bring to our organization. That's what drives me and what gets me up in the morning. From the moment I first met with the search committee and from the time I stepped on the campus, I knew I had found a place where people shared my commitment to improving the health and well-being of the community, especially those who are marginalized and underserved. I was drawn to Valley Health System not just because of its reputation for quality care, its commitment to patient-centered care, or its state-of-the-art facilities and technology. Those are all great things, but those things are not possible without people who are passionate about what they do. During my interview process, every board member, every provider, every leader, and every staff member demonstrated a dedication and commitment to Valley's mission of serving our community by improving health. It was clear to me that I had found a new place to call home. That said, these are challenging times. The COVID pandemic has changed much about the way we provide care, how our community views healthcare workers, and even the way we live. You can be confident that Valley Health's medical and executive leadership have taken steps to ensure protocols are in place to ensure the delivery of safe, quality care as we diagnose and treat those with COVID, as well as care for our other patients with emergent healthcare needs. Our health system will continue to respond and adjust in these changing and uncertain times, and we will endeavor to ensure financial stability for both individual employees and our organization as a whole. My work in meeting with medical and administrative leaders is just beginning, and likewise, I'm just beginning to fully understand Valley Health, what we are great at, where we must direct our attention more diligently to fully realize our potential, and our relationships with each of you, our physician partners, and our community. To that end, I would like to share with you the following key area of focus for me as your new CEO. First and foremost, the organization's relationship with each of you, Valley Health's caregivers. We want to be a great place to work and to provide safe, high quality, and affordable care. You probably hear this referred to sometimes as employee engagement. In my experience, how each of you feel about where you work and with whom you work and your relationship with your direct and senior leaders is foundational to achieving all of our other goals. Likewise, our relationship with our physicians is also a fundamental part of fulfilling our mission and achieving our vision, so this is an area of focus for me as well. Finally, with a team of talented and engaged Valley Health team members and physicians, we will continue to bring our focus to the quality and safety of our care and how patients rate their experience with us when seeking care. This is a body of work that I hope each of you will embrace in our pursuit of becoming a high reliability organization. I am confident that these focus areas will position us to achieve our quality, safety, and experience goals, as well as fuel our operational and financial success. Certainly, as I learn more about the work we are doing and hear feedback from each of you, this list will evolve. But for now, I want you to understand how I approach my role as your CEO and my overarching commitment to an environment where employees and physicians provide great care. In closing, I want to thank each of you for the work you are doing to serve our community in these trying times, and thank you for the warm welcome and for the confidence you have placed in me as I begin my tenure at Valley Health. I look forward to meeting each of you very soon. Oh, I almost forgot. If you see me in the halls or in the community, this is what I look like in a mask. I encourage each of you to stay safe and wear a mask. Thank you.